So the next presentation by Mark Wilson from University of Exeter will present us the gas training improves technical performance and resistance to distraction in virtual laparoscopic surgery.
Good afternoon, everyone. My name is Mark Wilson, and I'd like to apologize that I am not a surgeon, but in fact a psychologist with a specialty in visual-motor control. So with that apology, I have nothing else to disclose. There's quite a lot of research out there already which supports the contention that accurate gaze control seems to be a precursor to accurate motor control. And we're now trying to look at that within laparoscopic surgery, and particularly using the Symbionix lap mentor. And this particular study I'm going to talk about is using the eye-hand coordination task, which you can see there. So previous research which we have done has already distinguished different gaze strategies between experienced and novice operators, whereby experts seem to use a very efficient strategy, target locking, whereas novices use a very inefficient strategy, switching between the target and tool control. And we can measure this using a gaze registration system, which you can see here, basically a pair of glasses which captures point of gaze at 25 Hertz. So if I just show you some of these different strategies here, hopefully. Here we have an expert, so we're looking at the little red cursor is the point of gaze, and we can see how it's very, very consistent, very, very focused. It doesn't ever go and try and find where the tool is, so via experience, experts have learned to be very, very consistent and just focus on the target. In comparison, if we look at a novice here, having to, obviously, very new environment for them, having to find where the tool is, try and direct it towards the target, then come back and find the tool, and then go back towards the target. So the aim of our study was to see, could we sort of cheat experience and bypass some of this learning and actually just tell novices, train them to use the expert strategy that experts seem to have evolved into. So that was the aim of the research. And what we did was we randomly allocated 30 individuals into 10 in each group, 3 intervention groups. A gaze-trained group who were instructed via video to try and model the, try to model the gaze strategy of expert surgeons, this target locking strategy. We had a motor group who, again, via video training, were instructed to try and mimic the very smooth tool control that experts seem to show. And finally, a control group who were given no specific training, but were allowed to check their performance parameters on the lap mentor feedback sheets. Okay, so we performed a series of 3x4 ANOVAs with the groups, and we had 4 different conditions that we looked at. So a baseline condition, which was prior to receiving any training instructions, they performed this eye-hand coordination task. Then we used only 10 training trials because, again, previous research has suggested that with this very simple task, we were getting above expert levels of proficiency. Then we performed a very quick retention task, and finally a transfer task where we used a multitask condition whereby the trainees had to perform a concurrent tone counting task while carrying out the eye-hand coordination task. So if we look, this is the main performance parameter, completion time. And as you can see, there's a significant main effect for group, not at baseline. So these guys started with similar performance. But after only 10 trials, we can see that there's this significant performance advantage for gaze training above both other groups with 2 key post-hoc comparisons. This remained at retention. And I think probably most importantly, this advantage seemed to actually be more obvious or expand under the multitasking conditions. And I think what else was interesting is that as the gaze control group also actually had the highest tone counting accuracy score, it appears as though what is happening here is that they need less attentional resources to maintain performance on the task. So the training has been successful in helping them to get to a phase where they don't need to use the same amount of attentional resources to perform the task. What we're also interested in is, what are the process measures which underpin this performance advantage? And here we looked at, if we look at our gaze control measure, basically what we can see here is the degree, that the higher up the scale, the more the degree of target locking, so this expert gaze control strategy, which we have discovered. Then again, the gaze control group, the gaze train group, sorry, have got this high level of target locking. And as we come down the scale, we are looking at more of a switching strategy. So for example, if we look at 0%, will basically mean that you're looking for the same amount of time on the target as you are on the tools. So we can see that the other two groups are basically using a more of a switching strategy. We also had a look at tool control measures, and we found no main group effects for any of the tool process measures from the lap mentor. I'm just showing the total path length measure here. So again, we get this increase or reduction in path length from all the groups, no significant differences between the groups. So maybe the lap mentor algorithm mightn't be quite sensitive enough to determine these differences that we saw in both completion time and in our gaze measure. However, there is, if we took this and did the one-way ANOVA, there was a significant difference here at multitasking, so perhaps something interesting is happening there. So to conclude, these are clearly very preliminary results, but they do support some of the findings that myself and colleagues have shown before in sporting tasks. And it does show that we can bypass some of the learning curve by teaching people how to use a gaze-focused strategy that is typical of experts. And there may be at least two benefits of that. First, that we might be able to expedite learning and move people further along the curve, which would be important because obviously we can make more efficient use of trainees' training time and the expensive resources like simulators. And perhaps even more importantly, if we can find that trainees can be more robust under some of these demands that they are likely to experience in the operating theatre, like multitasking, this means that there might be greater transfer of training into the operating room. One other important result was that the motor control group, the guys who were instructed to focus on their technical skills, they were most upset or most impaired by the multitasking environment. So I think that there's a message there to be careful not to overburden trainees with technical instructions. And if I can show a nice example from sport, this is a excerpt from a tennis coaching guide trying to teach the forehand cross-court ground stroke. So if you can imagine the sort of attentional overloading with trying to do all of that, it would obviously be very tricky. So just to finish, it looks like our research seems to support this contention from one of the sort of founders of cognitive psychology, William James, who back in 1890 seemed to also suggest that a gaze focus, letting the body self-organize, might be more appropriate than consciously trying to control technical skills. So I'd like to thank you for your time. I'd like to thank my co-authors, my research partners, and also Sage for letting a psychologist come over here and embarrass himself. Thank you very much.
Excellent.